Determinant of Health presented by Marina Perino and Cesar Perino.
An increased understanding of health determinants provides more sensitive care at the individual level and to consider strategies at the community and policy levels that will address the root causes of health situations. The purpose of this presentation is to identify health issues and evaluate the determinants of health affecting the main subject, his family, and the community. There will be a focus on health promotions and interventions in hopes of improving their state of health. What is determinants of health? Many factors combine together to affect the health of individuals and communities. Whether people, healthy or not, is determined by their circumstances and environment.
Our client's profile. A man in his early 50s, Jason, has a compromised health because of the stress and family problems he is facing. He works as a casual healthcare aide and has 2 part-time jobs in a barn and in a restaurant in a small town in western Manitoba. He lives with his wife and 3 children. Being the head of the family, he is trying his best to provide them with a decent life. His wife does not have a job because 2 of his kids has a developmental disorder and she needs to look after them. Jason also has a family history of hypertension and diabetes. He is on his 50s and is starting to experience the signs and symptoms of these diseases. Because of all the stresses that he is going through, looking after his own health was not on his top priority. He drinks alcohol and is a heavy cigarette smoker, which poses him to a higher health risk. The 2 major determinants of health concerning Jason's condition are income and social status, and individual health practices and coping skills. It shows the understanding of how health determinants interrelate and influence each other. Emphasis of research is given predominantly to low income, unhealthy coping habits, and poor stress management that has a considerable impact on health.
The first determinants of health affecting Jason is income and social status. Because of Jason's family situation, he is obliged to work long hours every day to try to pay the bills and to put food on the table. It may be a good short-term solution to a financial problem, but it is likely not the best long-term solution. Poverty and income was emphasized in this matter. He lacks financial support and his wife is not able to help him financially. His wife cannot work because she is preoccupied in looking after their children. Paying for childcare is too expensive and they do not have enough money to pay for it. Stress is one big factor affecting his health. He spends most of the time working. Because of his busy schedule, going to a doctor for regular checkup is less of a priority. Even if he is not feeling well, he still goes to work instead of going to the clinic and be checked. His lack of understanding of diseases related to aging will greatly affect his health. His income and social status significantly affects his physical, mental, and social health. According to Potter and Perry, people with lower incomes are more likely to have chronic health problems, particularly cardiovascular disease and type 2 diabetes. Jason is at risk because he has a family history of hypertension and diabetes. Overtime is a normal routine for him. He's dealing with his stressful situation almost every day, and it started to affect his health condition.
Our second determinants of health is individual health practice and coping skills. Effective coping skills help people face challenges. In Jason's case, his way of coping is not helping him but instead put him on a higher health risk. He smokes 1 pack of cigarette a day and also drinks alcohol. These are his ways to relieve stress and relax after a long day at work. He also has a poor eating habits. He loves to eat fatty foods and does not have control on his diet. Due to these eating habits, he is prone to develop cardiovascular diseases and diabetes. Also, because he is too busy working, he usually does not eat on time and is not concerned about healthy foods and proper nutrition. Sleep deprivation is also one of the factors that might affect his health status. He usually goes home late from work and wakes up early in the morning to prepare for another day to work. These unhealthy practices and coping skills need to be urgently addressed to prevent undesirable health effects.
So here are the interventions for the individual level. Our first intervention is to recommend Jason to go to Employment Skills Center in the community. This agency provides access to information on employment, training, and financial assistance programs. They also offer jobs or career advancement options. If he can have one job that is a high-paying job, he can have more time for his family and for himself. According to research, an individual who are vocationally trained or educated tend to have more financial and healthcare resources and are better to cope with everyday problems. Therefore, we have to encourage Jason to seek further education or training by referring him to various community agencies that offers help or training because lack of education and skills limits abilities. Second, is to encourage Jason to consult his primary care physician because at his age and lifestyle, he is at high risk of developing cardiovascular disease and diabetes. Regular checkup is recommended for him to monitor his health status. The next is teaching him about healthy lifestyle choices and promoting effective coping strategies. Educating Jason about eating healthy with considerations of proper nutrition and to take care of his own health will definitely help him. Activities such as regular exercise, getting enough sleep, and maintaining balanced diet with emphasis on low salt, low fat, and low sugar diet. We will also encourage him to avoid too much drinking and to quit smoking. As a nurse, a referral to several support groups such as Smokers Helpline, Manitoba Quits, or Wellness Institute Smoking Cessation Program can be done. In addition, he can also go to public health clinic to avail for nicotine patch. Regular follow-up should be done to monitor if he and his family are managing well with the interventions.
For family-level interventions, we will advise Jason and his wife to apply to Manitoba Employment and Income Assistance for the meantime while he is undergoing training. They might get rent assist if they meet the qualifications. It will ease them a little bit of the stress and burden for the family. The money that will be saved can be spent towards healthcare as well. Secondly is to conduct a regular home visit to assess the condition of the children and monitor each family member's health status. In this way, we can specifically plan on what health services that are needed. Proper nursing care plan for the family will be formulated. Holistic approach to this problem is important, not only focusing on individual problem, but also the entire family's health. Thirdly is the access to healthcare. As a nurse, we can educate and inform the parents that even they live in a rural area, they can still access healthcare resources for their kids with developmental disorder. Telehealth is a good option for them, and it can be a good way to improve access to health services that might not be currently available in their community. A nurse can help book an appointment to a specialist together with the recommendation of the family doctor. This way, it will definitely relieve Jason's stress and for the whole family. It can address the determinants of health under healthy child development.
The impact of interventions to the community. The recommendation to the Employment Skills Center for Jason will definitely help him get a better job. Such resources will help reduce the unemployment rate. Therefore, it will have a positive economic impact to the community. Also, higher income was consistently associated with better health, and that is in reference with the World Health Organization. The community benefits when the family achieve optimal level of health. The healthcare system is relieved from the high cost of care that go along with it. Access to complete, quality healthcare services is important in achieving the goal of protecting and improving the health of the people in the community.